I am Kailash Balendran. I work in the Monitoring and Evaluation Hub of the Health Portfolio of Oxford Policy Management. We found that there's been an increase in fragility, and this fragility is in relation to a surge in conflicts or violence or natural disasters. And we found that there were donors and other key players that had tried to take steps to try and conceptualize and define this a bit further so that all people working in this sector can somehow become more aligned in their thinking and efforts to work in fragile states and resilient health systems. More and more this term fragility is being used. And we found that this term is being used in relation to trying to understand contexts where there is a high level of exposure to risks and a context that is not able to sufficiently deal or cope with those risks. And so when we started to look at that, we also saw there was another term that was coming out, and this was around resilient health systems. And so this applies that similar type of concept, but to a health system. And it looks at whether or not a health system is able to effectively prepare, plan, maintain, and adapt to various crises that affect it, such as the Ebola virus in Sierra Leone. Between 2013 to 2018, we had done 125 projects in these fragile contexts. 50% of the countries that are listed as fragile in 2018, OPM had done some work as the health portfolio. This also included, I think, 10 of the 15 extremely fragile states. So for example, in Somalia, we did a maternal mortality study through our fast response framework, HEART. We realized that fragile states is an important aspect of development and humanitarian-based work. And this is an area we want to better engage in going forward. And so what we hope to be able to bring is both a thinker and doer perspective to address these challenges of fragile states and resilient health systems. We want to understand, how does the humanitarian fit into development, and how does development fit into humanitarian? And what is that middle ground in between? And how can we leverage our experience in both sides to come up with something more strategic, palatable way to deal with this sector?